Thank you so much for coming to my channel. I want to share with you my surgically induced menopause, which really, at the end of the day, when I went into the hospital, I checked into the hospital, that was not supposed to be the intended outcome. So let me go back to January. So in January, I started having some pain on both of the sides of my lower abdomen. And historically, I've had kidney stones. So my brain really interpreted that pain as it must be kidney stones because, again, I have had them in the past and I have naturally just allowed the kidney stones to pass, which is very painful, by the way, for those of you that have experienced that. So when I started experiencing this abdominal pain in the sides of my abdomen, I said, kidney stones again. Kidney stones are very crystallized. So they look like shiny crystals is the only way that I can say, sandy crystals, depending on the size of it. So I would go use a restroom. So I would, for a week, I'd drink water. And then I tell myself, okay, the stones should be passing any time. So I would always go to the restroom and be on the lookout of did I pass the kidney stones? Well, that in the month of January, I didn't pass any kidney stones. And in February, I was still experiencing abdominal pain, still thinking that it was kidney stones. March rolls around and I'm like, my goodness, my stomach still hurts. And at this point, I don't understand what is going on with me. Are these just massive kidney stones? And I remember at some point even saying, my ovaries hurt. But my brain was using ovaries interchangeably with just kidneys because they're around the same area. So I would like to say I'm not a medical doctor. I'm just sharing my story. So if I sound very ignorant in terms of organs and body parts, it's because I am, because I know nothing about medicine. And hence the reason why I just lived with this stomach pain for 3 months practically. And also another component to that is that as a Latin American, you don't go to the doctor unless you're literally on your deathbed, unless you're bleeding profusely from a part of your body and you are on the verge of dying. And that is when you go to the medical doctor. So I have both this ignorance of these must be kidney stones and this cultural beliefs that the only time that you ever go to the doctor is if you're just dying. So at the end of March, while I was actually celebrating my birthday, my 47th birthday, the night before, I had the pain just intensified to a point that I thought, I think this is it. I think I need to go to the doctor. And I told myself, I don't think that this is kidney stones at this point. I think that this is something beyond kidney stones, and I'm just wondering if it's appendicitis. So while I'm in pain and I'm worried about taking any kind of medication because I don't know what it is, so I'm here not taking anything, but the pain went from a 6 of the kidney stone pain to this was, to an 8, even possibly 9. So I look up and I'm like, maybe it's appendicitis. So I tell myself, if I wake up with this pain in the morning, I will go and check myself into the emergency room because I don't think I can tolerate this pain for more than 24 hours or even 12 hours. So that night before my birthday, decide to sleep it out. And I don't feel well the next day, but I just go along and, recognize, okay, the pain has minimized. And so it must not be appendicitis. And also I was hungry the next day. So I'm like, okay, it must not be appendicitis. So I think nothing of it. If only I would have listened. Because even though the pain was no longer 8 or possibly 9, it was still lingering. It was still present. And I could not comprehend for the life of me what could be this pain. What could it be? And you would think that my brain would say, go to the doctor. My brain said instead, I have an upcoming doctor's appointment, like an annual appointment, and I will just let her know that I've had this pain that will not go away and it should be fine. So this was 2 weeks. It was like, if my pain is still present in the next 2 weeks, which is when my appointment is going to be, I will let my medical doctor know. A week passed by, and that week, which was a week prior to my appointment, the pain on a Monday night at 9 p.m., it elevated to a 10. I could not speak. I was nauseous and I could not keep food down. I couldn't even walk. In fact, I felt like I was going to stop breathing because the pain was so intense. It was as if the highest earthquake in the world, could ever possibly happen, and it just goes off the Richter scales. That's how I felt it was for me. And mind you, I have given birth, natural birth, twice, and even that combined did not, it was not equivalent to how painful it was. So I asked my husband to please take me to the emergency room. I don't think I can do it anymore. I could not wait the week that I needed to see the doctor, and I don't think I could sustain the pain any longer. So I check in. At this point, everything just turns into a blur. Like in the movies where it's slow motion and everything is moving both simultaneously fast and slow in front of you, and it's just blurry. And I'm trying to express what I'm feeling, and I'm hearing information, and I can't make it all out. And all I could think of is please remove the pain. I don't care what you have to do. Please get rid of the pain. So I am told to just wait 10 minutes, and they're going to give me painkillers, and then they're going to do a CT scan. So I wait the 10 minutes, and the entire time, if there was painkillers in my body, I could not feel them because I was in pain. And I get a CT scan, and the CT scan says it's not kidney stones and it's not appendicitis, which were two things that I overheard doctors saying. They're like, it must be kidney stones, it must be appendicitis. And these were the two potential diagnoses that they thought I was experiencing. And they came back and they said, no, that's not it. So now we are going to do an ultrasound. So I'm sitting there trying to breathe through pain, and I think they keep increasing the pain medication, and my heart rate is dropping. So I'm taking in deep breaths and exhaling, and they do the ultrasound, and I cannot make out anything that she's saying. She's saying, I see this and I see that, and I hear torsion. And then somebody comes in, whisper in my ears and says, you need emergency surgery, and we're gonna get you ready. I still have no idea what's going on. I'm scared, but I am in so much pain that the pain trumps any kind of fear that I have, that it's like, I don't care what I have to endure. Let me just go and get this done. Around midnight, one of the nurses came and said, we're gonna give you something different for your pain, because I still could not manage the pain. I still could not, it would not go below an 8. It was 8, 9, 8, 9, 10, 8, 9, 10. So they give me something, and they're like, you're gonna have to click this, and every 12 minutes you just click it. And that's all I can remember. And it was for the first time, I think since January, I could click a button and just feel that release of all that pain in my body. And I didn't want for that to go away, because the surgery was not happening until I think 10 in the morning. So I told myself, please don't leave me, whatever that was. I still to this day don't know what it was, the painkiller that they gave me, but it was in a bag, and it was through an IV, and I would click it, and every 12 minutes I would click it again. It was as if like I would go into sleep for like 12 minutes, my brain would wake up and say click. And then I would go into sleep for 12 minutes and my brain would wake up and click. And I think that this happened, from like whatever midnight until like 7 in the morning. So for that 7-hour span, I got 12-minute increments of sleep. And then they finally told me that the surgery was ready. And so I go into the surgery room, and I'm getting a lot more information. And one of the information that I am given by the surgeon is that they are going to have to surgically remove my right ovary because it had twisted on the fallopian tube. So my diagnosis was ovarian torsion. So it twisted onto the fallopian tube, and it was so twisted and so tangled that it could not be salvaged. The ovary could not be salvaged, and so it needed to be removed along with the fallopian tube. The surgeon did also say, we're also gonna check your other ovary, and we're gonna make sure that it's okay. And it could be a case where, if it's not okay, we may have to remove it. And so we wanna let you know that will put you automatically into menopause. I'm not thinking about menopause. I'm not thinking about anything other than I want the pain to go away. I don't ever want to experience this. And so for me, in my mind, it was just, here's my signature. I am signing every organ that needs to be removed from inside my body away as long as this pain goes. So I get prepped for surgery. It requires an incision, and a camera is inserted through your umbilical cord. So you get an incision by your belly button, and you get an incision on a side of your abdomen, which is, in this case, it was the opposite side of where my right ovary was. So you get an incision, and you get, the anesthesia, and you go to sleep. And the surgeon said that it wouldn't be any more than an hour. So I guess, an hour and a half later, the surgery was completed. Now, I don't know it's an hour and a half later. My husband tells me. And while I was undergoing surgery to remove the right ovary, apparently the surgeon found tumors on my left ovary. And she made the decision to remove the left ovary as well, along with the fallopian tube. So this surgery is called a bilateral salpingo-oophorectomy. Yeah, so bilateral salpingo-oophorectomy. And I'm trying to say it right because I had never heard of this before. Fortunately for me, the tumors ended up being benign, which was a relief. I had to spend a week kind of waiting to make sure that it was not cancerous. That week was a very long and scary week. But I am one of those fortunate ones where, if I did end up having tumors, they were not going to harm me. Now, this ovarian torsion is not a very common diagnosis that happens. I think maybe 2.5%. Maybe up to 4%, less than that, of the population experience an ovarian torsion, but it is incredibly painful, absolutely painful. If I would have known that it was even possible for my ovaries to twist with my fallopian tubes, and that is what I was experiencing, I would have gone right away, but I didn't. The only thing that I knew were appendicitis, or it could be kidney stones. So I played medical doctor, and I shouldn't have done that with my health. And so I am just relieved that, the worst case scenario did not happen for me, because ovarian cancer is just not something that people are going to readily detect. I mean, we don't go to the doctor, and like I had said, where my ovaries were hurting, we usually don't go to the doctor and you get any kind of screening for that, unless there's like a medical or family history of ovarian cancer in the family. The doctors there's not a screener for that. So, when I thought that could be a possibility, I was terrified. I was absolutely terrified. And I'm just so grateful that I for whatever reason, I was spared. And for now, I will take menopause as the worst case scenario for me. One of the ways in which I am now going to manage menopause is I am receiving hormone replacement therapy. I started last Friday. I have a patch that has both estrogen and progesterone, and maybe I will discuss at some point what that experience has been like. For me, I think it's just too premature to say how that's working for me, but I know that it's something that I'm gonna need to be on at least until the age of 52, 51, or 52, which is, the average age of when you experience menopause. So that is my story. I am so grateful for the privilege of having medical doctors and nurses that took care of me. And I say that as a privilege because I know that, like, not many people around the world have that. I think about other women or even little girls who also experience this, about how painful it is and not to have access to medical care, how scary that is. But I am very grateful. I want to live a life of gratitude, and I am going to try to honor my health better than I did, you know, even back 3 months ago, when I felt like I could just dismiss pain and not honor what my body was saying, which is you need to go see a doctor. So that was a lesson learned for me. Thank you all for watching these 18 minutes of me rambling, but this was just very important for me to say. I hope that if you are out there and you are experiencing any kind of pain, that if you do have access to a medical doctor, that you can go and check a doctor. And if you don't, that I hope that there is a way in which you can find some help and some support. And I'm thinking about, you know, everyone in the world who is living with a cancer diagnosis. And I'm just in awe of the strength that people have to wake up with each and every single day to engage in that treatment and to beat cancer. And I hope that someday we can beat cancer for good, and that people don't have to live their lives as if it were a life sentence, this diagnosis. So again, thank you all for watching, and I will see you next time.